what at all are you looking for in my urine? Welcome back to the channel. This is Missa, your international midwife. If you're new here, my name is Sada Sadiq, a senior midwifery officer from Kolebu Teaching Hospital. I come to you with the Pregnant Woman Passport, which is our regular antenatal book that we use here in the country and similar across the world. Today on the channel, we are going to talk about our antenatal record, which is gotten from our routine care whenever we visit the hospital for our antenatal clinic. This is found on page 7 of the antenatal record book. To begin with, most women wonder why they have to go for antenatal clinic. And even when they come, they are wondering why we do all the things we do, like weight checking their urine. They are wondering, what at all are you looking for in my urine? So today, that is what we are going to talk about. So when you come to our antenatal book, when we go into it, the first column, you find the date. So mostly you're given a date to come for clinic, or on your visit when you're given the book, a date will be written in. And after we're done seeing you, we'll give you another date for your next visit. So I am your patient throughout the Pregnant Woman Passport, and I am on my antenatal visit. So the first thing that I need to get when I come around before I see my midwife, or to see my midwife and then see the doctor, is to get certain things ready. And one of the things I need to get either from home or I get it in the hospital, depending on where I find myself, is my urine. So, following our antenatal booklet, what we have in our book, we do your weight check first. So for every pregnant woman, your weight will be checked. During your weight check, it is used to regulate or to monitor the weight you gain throughout the pregnancy. So let's say if you are gaining excessively, for example, the third trimester, where you're supposed to get between 0.5 to 1 kg weight every week, and you fall within that range, fine. But where it's below or above, and you visit the clinic, when we notice that, then the doctor will know what to do, or the midwife will know how to attend to you. You might be referred to see a dietitian, or you do further labs to check out, or a scan to check if the baby is growing so fast than expected. So during your weight check, it's used to check if you follow the regular pattern throughout the pregnancy. The second vital on the antenatal record is your blood pressure. So during your antenatal visit, your blood pressure will be recorded to ensure if you fall within the normal range. So when we realize that your blood pressure is increasing and then it goes above the normal, you're going to be attended to. Either you'll be given medications or you'll be admitted due to the urgency of it. So in a regular antenatal booklet, when your BP is high, that's your high blood pressure, it's going to be recorded in a red pen to indicate, so that in case the midwife checking your vitals is not the same person attending to you or consulting to you, especially in my facility where it is a specialist hospital, and then we have doctors attending to the client after the midwife has assessed the client with the vitals. Then in that case, the doctor is going to see, or the doctor is going to be alert by the using of the red pen in the booklet. But for our clients we are using, our client has a blood pressure of 130/80 on this visit, and the weight was 94.5, which from the last visit having 93, our client is in the normal range. Next is the client's urine. Okay. So at this point, we're going to check our client's urine, and we realize from our booklet that our client is having 2 classes of the urine protein. These are the parameters that are used to check for the urine protein. So in a case of a 2 classes, and this same client had a plus on the previous visit, in that case, then we need to have a further management for this client. So if it's a doctor or a midwife seeing the client is possibly going to have to do this lab for us, possibly bring it as soon as possible or within the few days on her next visit. So with a 2 pluses, it could indicate so many things, like a kidney infection, a urinary tract infection. It could be stress. It could be from extremely strenuous exercise. It could be due to dehydration. It could be due to fever. All this can give you proteins in your urine. So when we realize it and we give you labs to do, kindly do it. Mostly the lab that will be given for you to do will be a urine RE. So that with the urine RE, there's going to be much more of a urinalysis to find out exactly what the problem is. So in case any further test is needed after that first line of examination, you're going to be asked to do other tests for us to see. It could be, as I said, any of the things I mentioned, like kidney, urinary tract, etc., etc. So afterwards, you're going to be seen by your physician or your midwife, who is going to assess your abdomen. So during the abdominal assessment, there's gonna be so much to be done for you. But before I continue, if you haven't subscribed to the channel, kindly subscribe to the channel and hit the bell button below so you do not miss any video I upload. On our abdominal examination, we are gonna measure the length of your abdomen to find out if it is growing too big or is within the normal range. Mostly, if your gestation is about 34 weeks, your abdomen should be around the same centimeters, not so big from it, not so far from it. If there is a +1 or -1 difference, is okay. So when we realize that it is so big, like about 3 centimeters or 4 centimeters below or above your gestational age, then we need to do further assessment like a USG scan to find out the amount of glycol and the weight of the baby to determine what exactly could be wrong. It could be due to polyhydramnios or you're having a big baby. So our client is 36 weeks and her measurement is also 36 centimeters. Previously, she was 34 with a measurement of 33. So we still find it to be in the normal range. And then with the presentation, our client's baby's presentation is cephalic. It could be breech, it could be transverse. So depending on what you see in your book, it will determine the position in which your baby is coming with. As in whether the baby is coming with the head, which is cephalic, whether the baby is coming with the foot or the buttocks, which is the breech, or if it's transverse, if the baby is lying on the side facing your pelvic region. Then the descent is checked. The descent is how low your baby's presenting part is to your pelvic region, as in whether it's falling in or it's descending. So this one is much more like a midwifery term, but it happens mostly. The descent will keep decreasing as you get into term, and when you get into labor, it's gonna be fixed and will come down, and that is how the baby comes. I mean, that is for the midwives and the medical practitioners to understand, but you have that in your book to help with your assessment. Your child's heartbeat, that is what we call the fetal heart rate. So during every antenatal, your fetal heart rate will be checked either with a sonicate or a peanut fetoscope. So when we do that, it is done for you to listen. So mostly, and now in the modern age, we use the sonicate so that you and your practitioner can all hear the sound of your baby. So the machine is put on your abdomen, and then you also listen to the heartbeat. And a figure is given on the machine which indicates the heart rate of the child. So that is what we write there as our fetal heart rate. And what we have here is 134. which is within the normal range. Next is our routine medications we give to you. So depending on where you find yourself in Ghana, in Accra, in the capital, the urban or the rural areas, wherever you find yourself, there is a particular routine of medication we give you, that is the multivite, the iron, the folic acid, and it's given to you to take care of yourself. The last part of the book that is of so much interest to me is your next visit. So you need to stick to your next visit because your health professionals are taking care of you in teams and in groups. So when you're given a next visit, kindly stick to it. Do not sit home and come anytime you want. But aside your next visit, if you have any problem, if you're not feeling well, if you feel this particular thing happening to me needs a health provider's attention, kindly visit the hospital and you'll be attended to. Don't say because I was asked to come in 2 weeks time, you haven't swollen feet, you're having headaches, and you want to stay in the house so that I so please, if you are not feeling well, kindly visit the hospital before your next visit. Thank you so much for staying tuned. I love you so much, and kindly subscribe to the channel, share with friends, share with pregnant women. I love you. See you on my next video.